red, itchy, irritated eyes? There's a good chance you have ocular inflammation. In this episode of OCuTALK, optometrist Joshua Davidson will be explaining what that inflammation is, what causes it, how it relates to allergies and mites, and what we can do to help alleviate the discomfort. Dr. Davidson?
I want to talk to you.
Not now, later.
No, now.
Hello, everyone, and welcome to OCuTALK. Today we're going to be talking with Dr. Joshua Davidson. He's an OD with the Williamson Eye Center in Baton Rouge, Louisiana. Dr. Davidson, how are you?
Hey, I'm doing good. Thanks for having me.
So let's start up. Let's just give an introduction to yourself. You're practicing in Baton Rouge. How'd you end up in Baton Rouge? Where'd you go to school? That sort of thing.
I actually grew up in Michigan, mid-Michigan. So you get off the map. I'm right here. Bay City. And so I went to undergrad at the University of Michigan, and my school was just in your town winning a national championship just a few months ago. So that was fantastic. I didn't make the trip, but clinic was too busy. So yeah, I went to University of Michigan undergraduate, went to Michigan College of Optometry for optometry school. And then, I just kind of wanted to explore. I'd been down to New Orleans a couple times, fell in love with the people, fell in love with the state. So moved down to Louisiana, worked a couple different jobs, ended up working at a small private practice. And then that didn't quite, work out, built a nice dry eye center. And then I got recruited to Williamson Eye Center, which Williamson is a huge family-owned clinic. I think we have 7 clinics now, tons of doctors. Anything that I could want, they give me for the most part. We got a brand new dry eye center, just tons and tons of rooms. It's great. So I came down here as just kind of a couple year plan, and now I'm down here for life. So.
Well, speaking of dry eye, one of the things we're going to be talking about today is inflammation, and I think we'll talk about how that can contribute and could be an indicator, right? So let's talk about inflammation in general, specifically as it relates to the eyes, right? But I think this is probably something all of us have experienced in one way or another. There are tons of different causes, as we're going to discuss today, but let's just talk about in general, when you're talking about inflammation in terms of the eyes, what are we talking about?
Inflammation shows up in a multitude of different ways on the eye and the ocular surface. And what I often see is, you'll be looking at that ocular surface and you can just kind of see that cornea as maybe a little edematous. You can see maybe the conjunctiva, maybe a little bit of a chemotic appearance, a little swollen. I firmly believe that the majority of my dry eye patients do have a huge inflammatory cascade. And so I have really, in my clinic, had a lot of luck with being pretty aggressive, hitting that inflammation. And, one of the things too is almost all my patients will come in and say, I don't know if this is allergies, because again, Louisiana, we have terrible allergies, right? I'm sure down there in Houston, y'all do too. But everyone thinks, well, do I have dry eyes, or is this an allergy thing? And I always tell patients that, it's kind of a chicken or the egg type deal. When you have inflammation on the front of the eye, it's very clear that inflammation then shuts down your normal tear production. Well, if you don't have normal tears, then there's nothing to wash the allergens away, whether that's pollen, which Louisiana and Michigan too, of course, but nothing to wash the pollen away. There's nothing to wash your pet dander away. There's nothing to wash your makeup away. All these things, the dust, the dirt, all that stuff stays on your eye longer, causing more inflammation, which then shuts down more tear production. So in my opinion, it's very much a vicious cycle. And really all dry eyes are kind of a vicious cycle. But if we address that inflammation, oftentimes our patients are very relieved, and they get relief pretty darn quickly. So I'm a huge proponent of really attacking that inflammatory cascade.
So let's talk about it a little bit deeper, right? So when we're talking about inflammation on the eye, you were talking about the conjunctiva, and for our viewers, let's talk about that, right? Like we've all had red eyes before, and red eyes is certainly I think part of what you're talking about, but it can be deeper than even just red eyes, right? Like there are other places that inflammation can show up. What do those symptoms look like, right? Like how do I know that I'm inflamed?
Yeah, and the redness is a good one because you think about it, if there's something wrong with the eye, and this this is one of my pet peeves, and I think it's the majority of eye doctors' pet peeves. When the eye is angry, likely from inflammation or dryness, but the eye gets red. And the redness is actually not necessarily a good thing, but that's showing us that, hey, this eye is actually trying to heal itself. It's building blood vessels to try to deliver the nutrients, the oxygen, all these things to try to fix itself. And that's where a lot of patients go wrong before they see their eye doctor is they say, huh, my eyes are red. I'm going to go buy this drop that takes the red out. In reality, that taking the red out is not a good thing because you're stopping the eyes from actually healing themselves. And then when the drop wears off, the eyes get more red. And it's actually so common. We have a term. It's called rebound hyperemia. So of course, like you mentioned, redness is a very big sign of inflammation. Also the burning. When your eyes are inflamed, again, you're shutting down your tear production. And for some of these patients, the eyes get so inflamed and so dry and so they burn so much that when we look at you behind the microscope and we add different drops to the front surface, it almost looks like somebody very delicately rubbed sandpaper on the front of the eye. And that's not good. So you're gonna definitely feel that. Of course, a lot of patients then have questions about, well, my doctor told me my eyes are dry or they're inflamed, and my eyes water all the time. Like they don't know what in the world they're talking about. These guys and gals are clueless. No, for the patients that are listening to this, that's actually a very common sign of dry eyes. Your body makes two types of tears. The first type is kind of like your baseline. So, we call it baseline. That's kind of what we can assess in clinic. Think of baseline like a kitchen sink. Your body can make a lot of it, or you can make a little bit of it. So you can turn up that faucet in your kitchen sink a lot or a little. If I grab you and we fly to Michigan, it's probably going to be pretty dry. And so our body should make more baseline tears just to kind of handle that environment. If there's not enough baseline tears, then your body's second type of tear actually kicks into gear, and that's called reflex. And reflex is kind of an all or nothing thing. So, if someone kicks you in the knee, you're going to cry. That's a reflex. If you watch a sad movie, you're going to cry. If there's a death, you're going to cry. When your baseline is so low and, your eyes are putting a challenging environment, wind, bright lights, smoke, your eyes are going to water. And that's the reflex coming to the rescue to help prevent damage. So that's another sign of inflammation is watery eyes. So, really redness, sandy, scratchy, watery, really, in my opinion, if your eyes feel pretty, bad in any way, it's probably something to do with inflammation.
Yeah, generally speaking, you shouldn't be feeling them at all, really, right?
No, and I'll tell patients that, my goal, for example, a lot of patients want to know what they should expect with treatment. And I'll tell patients, it's kind of like if you have a sore throat, man, that's all you think about. You feel the tickle. Oh, I wish my throat wasn't so sore. This is terrible. Or if you have uncomfortable shoes, that's all you think about all day. Man, these shoes are terrible. When you have dry eyes, that's all you think about. These eyes are terrible. Oh my gosh, I wish this wouldn't go away, or I wish this would go away. If we're doing our job as eye doctors, you're just thinking about your eyes less. It'll never be perfect, ever. I guess maybe if you move to Montana or and throw your cell phones away, throw away your computers, only eat fresh fish, drink the purest water, and just work out all the time. Maybe you'll be perfect. Probably not, because we all get older, but it'll never be perfect all the time. But our goal as doctors really should be to make you think about your eyes less.
So let's touch on that a little bit. I think you said this earlier that because I'll tell you, most people when you see some redness right there, or like what's their immediate thing? Oh, it's just allergies, right? Like it's springtime, it's fall, it's whatever. It's just allergies. So I would imagine that could be part of it. Can we describe what part does allergy play here, and is it the biggest part, or are there other things that could cause it as well?
Well, kind of the chicken or the egg thing, in my opinion. The first question that I ask if I suspect ocular allergies is, do your eyes itch? If there's an itch, there's definitely going to be, in my opinion, a component of either allergies. So if the whole eye itches, yeah, it's probably going to be some allergies. OcuSoft, you've got those great wipes. Those are fantastic for those. Those have been a game changer in my clinic. Patients love those. Or you could also just do an antihistamine drop. But again, clinically, I have a lot of luck if I can have a patient produce more water, more tears on their eye. That's going to also help their allergens. Okay.
Right.
So, it's again kind of a chicken or the egg thing. Which one came first, the allergies or the dryness? I have a lot of better luck helping the patient produce more tears to wash the allergens away rather than just hitting them with an antihistamine, which a lot of antihistamines, their side effect is they dry the eyes out. So that's just kind of what I have. But that you probably have ocular allergies if the whole eye itches, if you're just constantly rubbing your whole eye. Now, what's interesting is if it's just the eyelashes that are itching. That kind of brings us into potentially Demodex, which y'all actually have another great wipe that I've used a lot, the Oust wipe. That's kind of the big topic right now, if you want to kind of get into that right now.
Yeah, so let's touch on that, right? So you mentioned Demodex, right? And certainly you and I understand what Demodex is, but let's talk about for the audience, what is a Demodex mite?
Yeah. So this requires a very delicate explanation to patients in the chair because otherwise they're just gonna, depending on who that patient is, it can freak them out. But I would, if you were a patient and you've got Demodex, and I'm going to explain this to you, I'm gonna kind of go into how I do it. So I'll always tell patients, just like we have bacteria in our gut, you hear all about bacteria in your gut. Well, we also have bacteria on our face, our eyelids, and things like that. Well, we also will have parasites actually in our eyelashes, and these are called Demodex. And so these are something that pretty much everyone has, but unfortunately, some patients have more of an overproliferation. And these mites will actually live in your eyelashes, kind of the root. And for lack of a better word, they kind of poop out little toxins, and they poop out all this stuff, and they form these collarettes, basically these sleeves of debris around the eyelash follicles. And then what happens is all that stuff can also cause inflammation on the front of the eye. I don't remember the exact figures, but I do know that there was a study that came out that found that the vast majority of patients that are contact lens intolerant, meaning that I can't wear contacts, these are just, they're just so uncomfortable, they have a Demodex overproliferation. And the Demodex, for the longest time, we didn't really have any FDA approved treatments. We just got one, and it works great. It really does work great. But just like a lot of new treatments, man, it can be difficult to get sometimes. And so a lot of our patients are actually getting exposed to these kind of easier to access options like the Oust wipes and the Oust spray too, because doctors are actually starting to look at, look for Demodex more. Because, when we go to a conference now, there's people like me up there on stage saying, look for these things. We can do something about these. So, as a patient, you may have went to an eye doctor every single year or every 6 months for years and never been told you had these mites. Well, the doctor may have just not told you because no point freaking you out when there's not much we could really do about it. But
Right.
now that there's actually treatments and options for it, Now more and more doctors are kind of getting that comfort in discussing it with their patients. And that's a great thing. This is something that has just been kind of left alone for a very, very long time. We knew we knew they were there. Well, most of us knew that these mites were there. But now that there's some great options for treatments, it's getting discussed more.
Is there any indication of why one patient would have an overpopulation and the other patient is doing just fine? I mean, is there environment factors or is it just kind of the luck of the draw there?
Not that I have noticed. I'm not sure what the research says. Clinically, what I do see, and I see 30 to 50 dry eye patients a day. So clinically, what I see, and I do believe that research has kind of bared this out, that Caucasians of fairer skin with a history of rosacea, like I've got kind of rosacea on my nose, you can kind of
Right.
redness there, and I got rosacea here too. Those of us with this rosacea are much more prone to this.
Really?
So yeah, and that's something that I again believe the studies have shown us, and clinically it's without a doubt. If someone comes in with rosy cheeks, red nose into my clinic, there's probably a pretty good chance there's some Demodex there.
That's interesting though, and of course this is anecdotal, but it's very interesting. So okay, so let's talk about that, right? So we talked about some different treatments for Demodex, but so is our goal to kill off all the Demodex and be completely Demodex free? What are we shooting for here in this protocol that we're trying to help out with these Demodex?
That's a high level question. Good question. So I actually had that question, when you go and you do the lectures and these big meetings, they bring you in for the little, they talk to you about new developments and kind of what your thoughts are. That was one of my first questions was, wow, there's some great new treatments coming out here. And wow, we are clearing all the Demodex. Well, humans are symbiotic creatures. Should we be killing all these Demodex? And from my experience, that yeah, this does help tremendously well. Getting rid of all the Demodex. And I don't know if I've seen 100% clearing anyway in any of my patients. I believe in the studies they actually did find 100% clearing in a lot of them, but I see just a complete turnaround in how these eyes look and how these eyes feel with pretty much all those Demodex being eliminated. So yeah, in my opinion, I was very skeptical about killing them all and scorching the earth. But it works. I've had patients as young as 17, 18 say, this has changed everything for me. I had a young girl, 18 years old. She was using the wipes and the pharmaceutical. And, she was always very sensitive about the way her eyelids looked inflamed. She couldn't wear contacts. And she says it changed her life. And that was pretty much a complete resolution. If you were to ask my opinion, I would say I was against, kind of killing them all. But now, yeah, I think the evidence that I'm seeing clinically, we want them all gone.
Very good. So, okay, so we've talked a lot about inflammation. We've talked about different causes, right? You've got some allergic causes, you've got some Demodex causes, you've got lots of different things that can cause it, right? Is there anything that I can do as a patient, right, to try to avoid inflammation in the first place, right? Or is it just, again, is it just something that some people are just going to be predisposed to?
Well, you kind of got to go back to what I talked about, moving to Montana, getting away from, everything. Today's modern world, man, it's hard to get away from inflammatory, causes, whether that's, a fatty diet. Like for lunch, I went and had a fillet of fish. It's Friday. I don't know. I just had to get something quick, right? Like that's gonna be terrible. That's ugh. But it's just in today's modern quick world, I had to find something. No one's drinking enough water. People are drinking soda. There's so much sugar. Sugar is hugely pro-inflammatory. I had a couple products that I created that the goal of the product was to create something with no sugar because sugar is so pro-inflammatory. You look at your cell phones. Your cell phones. You're in front of your phone all the time, you blink substantially less when you're in front of your phone. And it's the blink that's pumping all these wonderful oils from our meibomian glands onto the ocular surface. And that protects the tear film underneath it from, evaporating. And then when those tears are gone, inflammation occurs. So the technology with us blinking less is causing a whole bunch of issues. I don't know if you can get away from inflammation. I think your best courses of action are to limit screen time. So, of course, the 20-20-20 rule, there's definitely something to that. Every 20 minutes, look at something 20 feet away for at least 20 seconds and give yourself a couple really good blinks. Using a great artificial tear like your Retain. Retain's a great drop. It's predominantly oil. So you use that, boom, boom. And that's going to help prevent the tears from evaporating off. Warm compresses, just a mask that you throw in the microwave a couple nights a week. You heat that thing up, close your eyes, you wear it for 8 to 10 minutes. You take this thing off. I always tell my patients, hey, when you take that mask off, if your vision's a little blurry, that's a good thing. That's all the oils making their way out. Again, when the oils don't get pumped out, that oil just sits there, super nutrient dense. It's a warm, moist environment. Bacteria love that. Bacteria cause inflammation. So, you've got the great OcuSoft scrubs and the foaming sprays and all this. To answer your question, I really don't know if it's possible in the modern world to avoid this inflammation. I think all we can do is just do our best to make it have the least amount of impact on our ocular comfort. And thankfully, there's a lot of great companies like y'all that are out there innovating and creating things that make our patients' lives easier.
Well, very good. This has been a very interesting conversation. As you said, especially with our modern lives, I think inflammation is something that we're all going to deal with. Even if it's just temporary from an illness or something like that, you are going to deal with this at some point. But it's important to understand that if this is something that's chronic, that's going on over and over again, that there's probably an underlying cause for it, and you don't have to live with that. And as a matter of fact, as you said earlier, if it's left unchecked, that could either A, be an indication of a larger problem, or B, could lead to a larger problem later if left unchecked.
Absolutely. And something else too, I want to, make a point to say, today's world, it seems like more and more people are getting diabetes. Diabetes, we know, affects the whole body. I see clinically that causes a lot of dryness, and that can definitely lead to inflammation. And the big one too, autoimmune issues, whether it's a thyroid issue, whether it's Sjogren's, whether it's arthritis, whether it's lupus. There are just so many autoimmune issues out there. And it seems like every couple of years we hear about, some new ones out there that are, kind of getting more prevalent. All these autoimmune issues are basically inflammatory based. And so, that's systemic inflammation. And guess what? We call the eyes the window to the body for a very good reason. We can find diabetes inside the eye. We can find high blood pressure. We can find high cholesterol. And you bet we can see inflammation if it's happening in the body too.
Dr. Davidson, this has been very enlightening to me today. I think for me personally, what I'm going to take from this is that, again, you generally speaking should not be feeling your eyes. And if you are feeling them or seeing redness or inflammation of any form that is chronic, go talk to your doctor about it, right? Chances are there's an easy solution, or at least there's a path we can get on to solve this.
Absolutely. There might not be an easy solution, but there'll be something that can make things better. I guarantee it.
Well, very good. Well, Dr. Davidson, thank you so much for being with us today. This is a very interesting topic. For y'all, those of y'all out there, if you have any questions about inflammation or anything you want to add to the conversation, please add that in the comments, and be sure to like and subscribe. Thank you all for being with us. Dr. Davidson, thank you.
Thank you. I appreciate everything y'all do.